Every year, millions of people die from cancer, and many of them had warning signs long before the diagnosis. The frightening part is not that the disease appeared suddenly. The frightening part is that the body was already sending signals, and those signals were ignored. Small changes, unusual fatigue, a lump, unexpected bleeding. Symptoms people dismiss every single day. Cancer rarely begins with dramatic pain. It often begins quietly and silently. In this video, we will look at 5 early warning signs of cancer that medical experts say people ignore far too often until the disease becomes much harder to treat. Number 1, a lump or swelling anywhere in the body. One of the most common early warning signs of cancer is a lump or unusual swelling somewhere in the body. This is something many people notice but choose to ignore. That can be a dangerous mistake. Let's be clear, not every lump is cancer. Many lumps are harmless. They may be cysts, swollen lymph nodes from an infection, or small fatty deposits under the skin. These are common and often harmless. However, cancer can begin when abnormal cells start multiplying without control. Instead of dying like normal cells, they continue growing and gather in one place. Over time, they form a solid mass called a tumor. These lumps can appear in areas such as the breast, neck, armpit, groin, or under the skin in different parts of the body. What matters most is how the lump behaves. Harmless lumps are usually soft, smooth, and movable when touched. They may even feel slightly painful. But a suspicious lump is often hard, irregular in shape, and fixed in place. It may not move easily under the skin. In many cases, it is completely painless, which makes it easier to ignore. Also, watch for skin changes over the lump, such as redness, dimpling, thickening, or unusual texture. If a lump appears and does not disappear within 2 weeks, it must be checked by a doctor. Ignoring it is a risk you should never take. Number 2, extreme fatigue that does not improve with rest. Extreme fatigue that does not improve with rest can be an important warning sign that something serious is happening inside the body. Everyone feels tired occasionally after a long day, poor sleep, or stress. That kind of fatigue is normal and usually disappears after proper rest. But cancer-related fatigue is very different. This type of exhaustion is deep, constant, and overwhelming. Sleep does not restore energy. A full night of rest does not fix it. Even simple activities like walking, working, or doing household tasks can suddenly feel unusually difficult. This happens because cancer cells are extremely aggressive. They grow rapidly and consume large amounts of the body's nutrients and energy to survive. At the same time, the immune system is forced to work continuously to fight these abnormal cells, which places even more stress on the body. In some cases, cancer can also lead to anemia, a condition where the body has fewer red blood cells to carry oxygen to tissues. When oxygen levels drop, energy levels fall dramatically. The result is fatigue that does not match your daily activity. If you feel unusually exhausted for weeks without a clear reason, do not ignore it. Persistent, unexplained fatigue deserves medical attention. Number 3, unexplained bleeding or unusual discharge. Unexplained bleeding or unusual discharge is a serious warning sign that should never be ignored. When bleeding happens without a clear reason, the body may be signaling that something is wrong internally. This type of bleeding is not caused by a visible injury, a cut, or a normal biological process. In some cases, cancer can damage nearby tissues and blood vessels. As tumors grow, they can irritate or break fragile blood vessels, leading to unexpected bleeding. There are several warning signs people should watch for. These include blood in the urine, blood mixed with stool, coughing up blood, or unusual discharge from the nipples or reproductive organs. Even small amounts of unexplained bleeding matter. Many people make the mistake of ignoring these symptoms. They assume it will stop on its own or believe it is caused by something minor. That delay can be dangerous. Unexplained bleeding can sometimes be an early signal of cancers affecting the digestive system, bladder, lungs, or reproductive organs. Early investigation can reveal the real cause before the condition becomes severe. If this symptom appears, Do not wait and do not guess. Seek medical evaluation as soon as possible. Early action can make a critical difference. Number 4, sudden unexplained weight loss. Sudden, unexplained weight loss may look like a positive change, but it can sometimes be a serious warning sign. Many people feel happy when the number on the scale drops. The danger is that they do not question why it is happening. Healthy weight loss usually comes from clear changes, better diet, increased physical activity, or lifestyle adjustments. But when weight drops without any effort, the body may be reacting to an internal problem. Doctors consider unexplained weight loss of 10 pounds, or about 5 kilograms, within a short period to be medically significant. One reason this can happen is cancer. Cancer cells grow rapidly and consume large amounts of the body's energy and nutrients. Instead of supporting normal body functions, those resources are redirected to fuel abnormal cell growth. Some cancers also release substances that increase metabolism and reduce appetite, causing the body to burn calories faster while eating less. The result is rapid, unexplained weight loss that does not match a person's habits. What makes this symptom dangerous is that many people celebrate it at first and ignore it. But sudden weight loss without effort should never be dismissed. If it happens unexpectedly, it is important to seek medical evaluation and identify the cause early. Number 5, persistent changes in bowel or bladder habits. Persistent changes in bowel or bladder habits can be an important warning sign that the body is under stress or disease is developing. The digestive and urinary systems normally follow a consistent routine. Most people know what is normal for their body. When that pattern suddenly changes and does not return to normal for weeks, it should never be ignored. Many people dismiss these symptoms, assuming they are caused by food, stress, or temporary stomach problems. Occasional digestive discomfort is common, but when the change becomes persistent, it deserves serious attention. Warning signs include ongoing diarrhea or long-lasting constipation, a constant feeling that the bowels are not fully empty after using the bathroom, or noticeable changes in stool patterns. In the urinary system, symptoms such as pain or burning while urinating, needing to urinate far more frequently than usual, or difficulty passing urine can also be important signals. These symptoms can sometimes appear when a growing tumor begins to interfere with normal organ function. Cancers affecting the colon, rectum, bladder, or prostate may produce these changes early. If bowel or bladder habits change and remain abnormal for several weeks, do not ignore it. A medical evaluation can identify the cause early and prevent serious complications. These are 5 early warning signs that major medical organizations around the world consistently urge people to take seriously. They are not random symptoms. They are signals the body may send when something inside is beginning to go wrong. It is important to understand that these signs do not automatically mean cancer. Many common and less serious health conditions can produce similar symptoms. However, the real danger begins when these warning signs appear and continue for weeks, and people choose to ignore them. Your body is extremely intelligent. Long before a disease becomes severe, it often sends small but important signals that something is not functioning normally. The problem is that many people dismiss these signals, hoping they will disappear on their own. That delay can cost valuable time. When cancer is detected early, treatment options are far more effective, and survival rates increase significantly. Early detection can often mean the difference between a manageable condition and a life-threatening disease. If you notice symptoms that are persistent, unusual, or unexplained, take them seriously. Do not wait. Do not guess. Consult a medical professional and get the proper evaluation. Your health is too important to ignore the warnings your body is giving you.